2国际卫生合作大会暨中非医院对口合作论坛的开幕式。我是江苏卫视的主持人孙倩。
女士们、先生们，大家好。It's a real pleasure to be here with all of you today at this Global Health Conference. I, like many of you, I'm sure, believe that healthcare is transforming in front of our eyes. And those that embrace innovation at the moment may see more than just improvements in operational efficiency, but also in improved patient outcomes. But there will be challenges, and so I would like to share with you not just some challenges that we'll face in dealing with the digital patient, but also some examples that I've come across globally and locally, which will encourage us to keep on going. And then also the changing role of hospitals in smarter healthcare cities. So why is healthcare a little bit slower to adopt technology than some other sectors? Actually, when you compare healthcare and the technology sector, they say very different things. The technology sector, as you've heard, they try to rush together a minimum viable product and then hope that future iterations will be improved as they go. And they say things like fail fast, fail often, fail forward. But in healthcare, as we know, we prioritize doing no harm to patients. And it may even take some time, even after a new treatment is approved, it may take up to 10 years or more for many clinicians to be comfortable with that new treatment, even if it's been proven to be better than an older one. And then by the time a healthcare platform is launched, it may already be outdated. And some of the users may then get disappointed because they're used to a better user experience, UX, on another e-commerce or social media platform. But this is where China is really in a good place to start innovating, even more than in other countries. These trends are not unique to China, but the speed and the scale at which they are impacting China is redefined at a slightly slower rate due to its conservative nature and the many policies we have in place for data and patient protection. And even within healthcare, these trends may impact different healthcare stakeholders differently. Virtualization is already impacting hospitals with internet hospital services and chronic care management. But some of these other trends, like digital urbanization and mobility, they may influence wearable companies or device companies that place medical devices in the home. These companies may have to innovate faster because they're closer to the consumer. But they have an opportunity then to learn more about the patient and gather some of that lifestyle data. Which brings us on to the next challenge. There is a limitation really for doctors in the healthcare system to get enough data on the patient because, as we know, the social determinants of health have more of a contributory factor to our healthcare than all the services we receive in the healthcare system. So this is really an opportunity for healthcare stakeholders to work with others, even if they can't access consumer data themselves. If they can work together in an open ecosystem with people who are able to access lifestyle data, then we can start to learn more about the patient and improve our services. Many people think that doctors know more about their healthcare than anybody else, and we hope that they would. But really, when we look at the different sorts of data that are out there, the healthcare data that exists in the healthcare system is now smaller than data that is being generated in the community through wearables and lots of other areas. And if you look at the size of the circles depict the size of those data silos as they are now. And the electronic health record is actually quite small. But at least if we put more concerted effort into consolidating more of our medical data into the healthcare record, then we can start to see some improvements in retrospective epidemiology and disease surveillance. And I'll share a few examples of a good visualization of some research that was done by NHS Scotland, where, as we know, many people who have chronic diseases, they have lots of other chronic diseases as well. I've highlighted diabetes here because you can see that more than 50% of diabetic patients also suffer from hypertension. And then if you add in age-related data as well, you can see that patients who are over 65 have more than 6 other, not just in AI image analysis, but you can also apply AI on electronic health records, which is challenging in its own right because it is a vast amount of data and there's lots of inconsistencies in that data. But this is a good example of Guangzhou Women's and Children's Hospital in a global collaboration with the University of San Diego, using AI in a natural language processing algorithm to provide diagnostic services of equal quality to pediatricians. And as we start to apply AI to electronic health records, let's say, it becomes even more important then to all agree on standards and governance for that data and how that technology can be applied. This is a set of frameworks from the National Health Service, their code of conduct, really, for applying technology across all hospitals in the UK. And you can see that clinical effectiveness and interoperability are hugely important. But before we can apply standards for technology, we also need to have standards for clinical practice. And this is a group in China, the China Clinical Practice Guideline Alliance, who recently had a launch ceremony in May this year, also supported by the University of Nottingham, Ningbo. And their mission is really to help to improve China clinical practice, the guidelines, the standard of those guidelines to international level based on World Health Organization standards. So as healthcare becomes more patient-centric and less hospital-centric, trends like retailization of healthcare may start to mean that some services that are traditionally inside the hospital walls may start to move outside of the hospital to some other partners. Services like imaging and vaccination, let's say, because we'll be working together in a healthcare ecosystem of connected intermediaries that all share the same data. But for this to happen, obviously, the technology that's connecting all of these entities to a city operational platform that collects all that information and makes it available for the smart hospital and other institutions. And then we can start to provide these smart healthcare services that profile patients in large populations, provide good risk scores, and more tailored care plans that, as I mentioned earlier, start to consolidate all those comorbidities together so we have a more personalized care plan. And over the last few years, living and working in China, I've found some examples of these smart healthcare services already, and I can share some of those with you. As we know, chronic disease is a huge burden to China. And this is a good example of a multidisciplinary partnership, which is really what we need to innovate as healthcare, because health technology is a combination of 3 disciplines: healthcare, yes, but also technology and social sciences as well. So I think smart home tech is a very exciting field, and we can see that China is accelerating in smart home technology faster than anywhere else in the world, led by companies like Xiaomi, who have more than 1,000 smart home products, all connected, centralized with one app. Sleep tech is one area as well that's much in need within China, because Chinese people suffer with sleep disorders at a 10% higher rate than anywhere else in the world. So this is an example of a home device, Sleep Hub, that uses sound technology to retrain your brain so that you can experience all levels of sleep. And lastly, it's not news. Everybody knows that China is aging, But what is new to some people is the place where Chinese senior citizens will age. Many technology companies are developing solutions for elderly care homes, when in fact, if Chinese people prefer to age in place, it's about only 3% of people that will seek a elderly care facility, which means that companies like Legrand, who are providing lots of, a full range, let's say, of home monitoring and sensoring equipment that's connected to medical staff in the community. And in this way, I believe China can lead the world in integrating digital consumers into the healthcare system. 谢谢大家。
好，谢谢。